Today I am going to discuss about signs of postpartum depression, and how to cope up with that. Many women, after having a baby, experience bouts of mood swings. During such a period, it is not unusual to see them happy and elated one instant only to burst into tears the next. This condition is known as the baby blues, or more precisely, postpartum depression. Women around the globe are resenting the day that their bodies will go through a transformation. When postpartum depression kicks in, women often feel sluggish, unconnected to reality, and often undergo several other symptoms that include depression. What is postpartum depression? Postpartum depression is a condition suffered only by women after pregnancy. The symptoms usually manifest themselves within 3 to 4 days after delivery and may last for several days afterward. Their thinking is often irrational and their emotions are often tangled. One minute they are struggling to go to sleep and the next minute they can't seem to wake up. Once a baby is born, the family, friends, mother and so forth is supposed to join in a joyful expedition. Sometimes mothers go through postpartum depression, however, and the birth seems more like a curse than a joyous moment. Instead of sharing a happy moment, mothers often feel a sense of guilt because they may resent the birth of their baby. During such a time, the woman suffering from postpartum depression may feel down, have a hard time concentrating, lose her appetite, and exhibit all other symptoms commonly associated with clinical depression, including loss or decrease of interest or pleasure in many daily activities, loss or decrease of energy and feelings of fatigue, both mentally and physically, difficulty falling asleep or staying asleep, insomnia, disturbed sleep patterns, or conversely, sleeping more than usual, hypersomnia, increased tendency to get emotional for no apparent reason, tearfulness, feelings of worthlessness, hopelessness, or guilt, marked and unexplained weight loss or gain, excessive worrying or anxiety over hurting the baby. All of a sudden, you begin feeling sadness, despair, worthlessness, and insomnia kicks in. Then you go through panic attacks while feeling a sense of shame. In addition, it doesn't stop there. Next, you begin feeling fear of losing control of your actions. You start feeling like your mind is tumbling, and your concentration has vanished. Still, you feel nausea, agitated, your heart races, and your breathing is complicated. The symptoms are increasing as you feel an imbalanced level of worry toward your child, hopelessness since you have no control, exhausted from all the mental changes, and suicidal because you see no way out. The battle is just beginning. Mothers suffer from postpartum depression often have an underlying psychological impairment, possible biological imbalances, including post-traumatic stress if the mother undergoes a horrible birthing. Most professionals will treat postpartum depression with antidepressants, combining it with therapy. A large percentage of women experience postpartum depression after childbirth. For some, the symptoms may not start until several weeks or months later. As such, if you feel suddenly down within 6 months of childbirth, there is every chance your condition might be postpartum depression. Who are susceptible to postpartum depression? The likelihood of postpartum depression increases if you had previous postpartum depression, you had depression, not related to pregnancy, you suffered or continually suffer from severe premenstrual syndrome, PMS, you had a difficult marriage, you have few family members or friends to talk to or depend on, you had gone through stressful life events during pregnancy or after the childbirth. What causes postpartum depression? The more common question asked is why women get postpartum depression. The exact cause of the condition is yet unknown. Some believe that the change in the hormone levels during pregnancy and right after childbirth may have something to do with the development of the condition. The change may cause the chemical balance in the brain to change, thus triggering the symptoms of depression. How long does postpartum depression last? How long the condition lasts varies with each patient. Some women report that they feel better within a few weeks after first feeling down. Others report that the feelings of hopelessness and emptiness last for many months, during which time they feel they are not themselves. It is important for mothers with postpartum depression to seek help immediately, since the diagnosis does not only affect the patient, it affects everyone around you, including your baby. Babies need their mother, and when the mother is unable to provide emotional nourishment and loving care, and then a baby will suffer as it grows into adulthood. Just like any diagnosis, there are triggers that may interrupt the mother, including difficult births, isolating oneself, death, changes in living arrangements, hereditary, financial difficulties and so forth. Unfortunately, some of these triggers are going to happen. Women who have experienced severe depression not related to pregnancy may experience postpartum depression for more than the normal few weeks. In either case, always remember that help is always around. Most therapists have found treating women with postpartum depression, treating them with antidepressants and therapy has worked wonders. Recently, studies are finding that depression may also be treated with electromagnetic therapy. Scientists are constantly searching for a solution to treat depression, so the end of the world hasn't arrived. There is hope. Studies have also shown that writing down your episodes, feelings and so forth is a great therapeutic relief. Talking is also a great source for eliminating stress, which is often linked to depression. It is important to get regular checkups after your baby is born to eliminate biological reasoning for the postpartum depression. If you are suffering postpartum depression, it is also important for the family to offer support and understanding. Since you may have suicidal thoughts, the last thing anyone needs to do is push you over the edge. It is also important that the resentment you feel is not necessary toward your baby. It could be that you resent an area of your life, or an occurrence, and the baby seems to be the target. You might want to try listening to easy music when you feel a sense of loss, or episodes of the diagnosis erupt. Music has proven to heal the soul. In addition, you might want to start exercising, since this too has proven to do wonders with people that suffer mental or physical illnesses. Exercise relieves the mind often because you are doing something to better yourself and improve your health. Therefore, if you are in postpartum depression, there are answers and you should never give up hope. And if you want more videos on environmental, make sure you subscribe so you don't miss out on future videos. If you feel the content is useful, please hit the like button. I really hope this video helps, and if you have any questions or doubts, please leave a comment below and we will revert back.